Next on our research updates track, let's welcome Dr. L. Penny Rosenblum, Director of Research, American Foundation for the Blind. Dr. Rosenblum discusses her current research, access and engagement to education for students with visual impairments during COVID-19.
Hi, I'm Dr. Penny Rosenblum, and I'm the Director of Research at the American Foundation for the Blind. Today I'm talking about the Access and Engagement Survey, which focuses on education of children with visual impairments, their teachers of students with visual impairments, and their orientation and mobility instructors. Now, the survey came about because on April 3rd, 2020, AFB, along with 14 other organizations and companies, launched the Flatten Inaccessibility Survey, which focused on how COVID-19 is impacting the lives of adults with visual impairments. When that survey launched, my colleague, Dr. Tina Hertzberg at the University of South Carolina, upstate, reached out to me at the American Foundation for the Blind and asked if we could do a similar survey to focus on education for students with visual impairments. I'm pleased that AFB, University of South Carolina, upstate, and 17 other organizations, companies, and universities came together in a very short time to launch Access and Engagement on April 22nd, 2020. The survey closes on May 13th. So can't really share any data with you, but I can tell you that we anticipate having at least 1,700 usable surveys from families and professionals in Canada and the United States. When somebody enters the survey, they have a choice of using English or Spanish as their language for the survey. Families who have a child who is birth to 3 years of age answer questions about that child's early intervention services. How have those services changed as a result of COVID-19? For example, is somebody now not coming to their home? Is there a change in where they take their child for services? Are they having less or more communication with professionals working with their family? What about the IFSP, the Individualized Family Service Plan? Are they overdue for a meeting? Was that meeting held virtually, which was a new experience for the family? So we want to learn about the family's experience. We also want to know if the family is concerned about the child's developmental progress as a result of either services stopping or decreasing or changing. So we explore that as well. We also ask questions if the child is transition age about what is going on with the transition to preschool. Are things proceeding as they were planned, or has there been a change, and what has that change been? If a family indicates they have a child who's a preschool child, we ask similar questions about services, but first we begin by asking about how the family was notified that there would be a change from where that child was going to preschool, for example, if they were going to the school for the blind or to a classroom. We ask about the communication that they received to let them know how things would be changing. If they're now in an online environment and how that is working for them, do they have an ability to access online information? We ask about services from the preschool teacher, if there's one involved, the teacher of students with visual impairments. That person may be the preschool teacher, or they may be a support person, so we want to get at that. Orientation and mobility services and how those are being delivered. We also ask about whether the family is receiving lesson plans, and if they are, do they need to upload documentation, whether it's a video or something that the child makes, to show that the child has done the work? And how is that impacting the families? Are they finding that helpful? Or are they finding it stressful? Next, families or the person doing the survey is asked about school-age children. So if they're a family member of a guardian of a child kindergarten through the end of school, whether that's high school graduation or aging out of special education, we want to find out how things are going there. So similar to the preschool child, we want to know when the decision was made to stop having children attend school. How was that communicated? Did the child have all the materials at school now at home? And if not, how is that impacting the child? How are services being delivered, if at all? Is the child receiving packets of paper? Are those accessible? Are they meeting with teachers online? If there are videos for them to watch, are those accessible? What kind of communication is the family having with the teacher of students with visual impairment or the O&M instructor? We also want to know about transition for the child. So perhaps this is a child who is getting ready to go from elementary to middle school, so anticipating a new school environment for the fall. How is that transition progressing, if at all? What barriers have they experienced around that transition? Families are also asked to talk about communication. So, do they feel like they're having the same amount, less, or more communication with the child's teacher during these challenging times? The next section of the survey is for professionals. So we may have a family member who says, yes, I'm a family member of a child who's a preschooler, and then they get to the section about professionals, and they're also professionals. So we want to make sure that if somebody's in both roles, they have the opportunity to share. So if somebody is employed as a teacher of students with visual impairment, an orientation and mobility instructor, and or in the dual role for the 2019-2020 school year, they're asked to complete this section of the survey. And in this section, we want to know whether or not they're currently working during the COVID-19 pandemic. If they are working, we have more questions, obviously, than if they're not, but we still want to know about how the transition was made. How much lead time were they given? Were they able to take the materials home with them that they need? Did they receive any training from their school or district on how to deliver online education if they're doing so? How are they getting Braille materials to their Braille students if they have any Braille students on their caseload? What about providing supports to families whose children have multiple disabilities or deaf blindness, and the child's actually not going to be logging into the online system? So we have a lot of questions for the professional. As far as orientation and mobility instructors go, we ask a series of questions about how they're providing instruction to young children or children with multiple disabilities or deaf blindness, or beginner travelers. How are they providing services to students who are learning routes around the school, for example, or the neighborhood? Thinking about students who are in small business areas learning to travel, or ones using public transportation. So we provide a list of potential ways the professional may be delivering the service and ask that O&M instructor to let us know what of these options they're using. We ask instructors and teachers of students with visual impairments to provide information about their level of support that they're feeling like they're receiving. We also ask them about how they're balancing if they have children at home, working from home, and at the same time, their own family. So we have a lot of questions to help us really understand how COVID-19 is impacting education, both from the family guardian perspective and from the professional perspective. Now, once these data are collected, which we anticipate being May 13th, we'll close out the survey. We have a great survey analysis team. We have Dr. Paola Chanes-Mora at the American Foundation for the Blind with me. Dr. Tina Hertzberg, as I mentioned, was the individual who came up with that idea for the survey. She's at the University of South Carolina Upstate. We have Dr. Tiffany Wild at Ohio State University, who is also involved in developing the survey. Dr. Catherine Botsford will be assisting with the data analysis as a consultant for the American Foundation for the Blind. And Rhett McBride, who is a doctoral student at the University of Georgia, will also be joining us. So our plan is to clean the data, go through it very carefully, and take a look at what trends we see. How is education being delivered to our students? What are the successes? What are the challenges? And how can we, as a field, come together to ensure that students with visual impairments, not just during this pandemic, but at other times when there are challenges, are receiving access to and engagement in education? It's going to take us a while to get those data up on our website. The website for this study is accessengagement.com. We have a page for results, and we'll be posting results throughout the month of June of 2020. We anticipate writing a report that will be available to the organizations that are behind the study and the companies and universities. We hope to have some manuscripts prepared. And when we all get back to meeting live for conferences, some conference presentations. If not, we'll continue to be in the virtual world. So our plan is to really disseminate these data widely so all of us can have a better understanding of how education is impacted by the COVID-19 pandemic. Appreciate your interest today in learning more about this topic. Very open to ideas and suggestions, so please feel free to reach out to any of us on the research team if you have a way that we can look at the data differently. So the data team is very excited about the work we are getting ready to undertake. If you have any suggestions for us on how we can approach data analysis or look for funding, we're very open to those ideas. We appreciate how many people have responded to the survey. So if you're one of the individuals who did, thank you so much for taking the time. And we wish all of you much safety during these challenging times. Thank you.